before that. Okay, never mind. We can just go. Okay, so these are the slides. Okay, so these are
still before sale. Chinese and Maya accused slide still before sale.
Is there?
This is the slides before.
Oh, ada slide yang tak nampak dekat sini. Okay. Oh, so there's a slide. I can't see from my screen. Okay, so a slide. Okay, so the question is that. So there's a slide, yeah.
Yes.
Okay, so the question is that. So there should be a table there. Is there a table there?
Next slide.
Ada. Okay, tak apalah, kita straight away. So because the previous slides, I can't. It's not the table is not visible. So never mind. So these are the barriers. You can see from the slide. These are the barriers that fragment our care. So one of the most important barriers that I would like to point out is very much related to our talk today. That is the healthcare silos and also the poor communication. So the healthcare professionals often work. So this is the original or the conventional way of working in the professional world. So healthcare professionals often work within their own disciplines, and in patient care, usually this the way that we communicate or the way that we work is physician oriented, doctor oriented. So they often work within their own disciplines, and physicians focus on diagnosis, pharmacists on medication, nurses of course on monitoring, and dietitian on nutrition. And also, for example, physiotherapists worked on exercise or lifestyle interventions. So while each profession performs its role, limited collaboration can result in fragmented care rather than coordinated and patient-centered care. So now we are moving because now we are trying to treat patients holistically. So closely related to healthcare silos are poor communication. Okay, so information is sometimes not shared or effectively communicated between healthcare professionals. So, or even between healthcare providers and patient even. So a pharmacist, for example, from my focus, a pharmacist may identify a potential drug interaction, but unless the information of this interaction is communicated to the physician, then the rest of the team, then there's nothing that we can do. The opportunity to prevent harmful effect of the drugs can be missed, and this can relate to the earlier slides whereby 20% of hospital admissions is actually to medication from chronic diseases. So in other words, chronic disease management must move beyond prescribing. Okay, it requires interprofessional collaboration, community engagement, and also the most important thing is patient empowerment. And this is where pharmacists working alongside physicians, nurses, dietitians, or even physiotherapists and community health workers can make meaningful differences. Okay, so next slide, please. Okay, so now, so we just discussed before the barriers that fragment the healthcare. Okay, professional silos, poor communication between the healthcare professionals, misinformation, even polypharmacy. Polypharmacy is actually due to perhaps miscommunication. A big chunk of it is because of that, and the growing challenges of an aging population. This is one of the most important situation actually, not just in Malaysia, in all over the world. So the answer lies in the paradigm shift. Okay, so from isolated practice to integrated patient-centered care through interprofessional collaboration. So interprofessional collaboration in healthcare shift from a traditional physician ataupun doctor-centric hierarchy to an we call it egalitarian. So more and more nowadays we are the term egalitarian model is coming up, or you might be more and more you akan biasa mendengar kata egalitarian when talking about IPC or interprofessional collaboration, where all disciplines, egalitarian model, where all disciplines actually nurses, pharmacists, therapists, doctors share the decision involved in the decision making. So traditionally, healthcare often is organized into silos. Okay, doctor oriented, doctor makes all the decisions, and actually this is what is still happening. The core of the business in patient care is that is still the conventional way is still happening. Each healthcare professional works within their own expertise, providing excellent care within that discipline. However, chronic disease such as diabetes, for example, hypertension, CKD, and other cardiovascular disease are complex conditions. It affects the patient's life, and one profession rarely fits into this patient care. So not one profession can actually manage the chronic disease. So in the past, healthcare decisions were often provider driven, meaning is usually doctor driven, with one professional determining the treatment plan. Of course, the doctor centric. So, however, today the healthcare sector is moving, although not rapidly, but we are moving, shifting towards a new paradigm. So today we recognize that the best decision comes from shared decision making involving not only different healthcare professionals but also the patient and also their family. So this is the essence of intra-professional collaboration. So rather than treating a single disease or symptoms in isolation, we now focus treating the whole person. And I think, for example, in nursing, although I'm in pharmacy, but in nursing punya syllabus, there is syllabus yang related to psychological management of psychological illnesses, especially in chronic diseases, how the nurses help managing chronic diseases pertaining to mental health in patient. So this actually helps in nurses to help treating the patient as a holistic person, holistically. Okay, so instead of occasional communication that occurs only during referral or hospital admission, interprofessional collaboration usually promotes continuous, open, and trust-based communication. So this is actually the ideal, the benefit, the objective of intraprofessional collaboration. Okay, so next slide, please. Okay, so instead of asking now, actually, what medicine? So this is common. What medicine should I prescribe? We now need to start asking actually, what does this patient needs to achieve a better health? Okay, chronic diseases are like, again, as I've mentioned just now, chronic diseases are lifelong conditions, and successful management requires much more than controlling or the laboratory findings of this patient, and it's more than just prescribing another medication. So if you can see the slide, medication still sits at the top of the diagram, not because it's more important than the others, but because most patients with chronic diseases, this is where formal healthcare encounter begins. And this is also conventionally where it ends. The prescription is written, and in the conventional model, in the conventional way of treating patient, that is where medical system engagement with the patient actually ends. They come and they go back. So it starts and ends there. But if you see the diagram, so look how the medication also interlaps ataupun overlaps with other elements in the diagram. It overlaps with nutrition because a big chunk ataupun when we prescribe drugs to the patient, let's say statins ke ataupun calcium channel blockers ke antidiabetics drugs, these are also related to the nutrition level of the patient, the absorption, the cytochrome P450 in the liver. All that will also depend on how the drugs will be absorbed, distributed, metabolized, and of course excreted. So, and for example, medication also overlaps with physical activity. For example, statins or high levels of statin, which is a what anti-hyperlipidemic drugs. That is, high levels of statin can actually cause muscle disintegration, fibromyalgia. So even though if you see all the other elements doesn't have the word medication, but they are actually interrelated with medication. So this is where pharmacists, although the word medication is not there, nutrition, physical exercise. So even though in reality or conventionally this is not where the pharmacist maksudnya memberi counsel, tetapi we can see that it actually relates to the work of pharmacist. So the pharmacist has actually a role in each element of the patient care as holistically. Okay, next slide. So you can see it's not that visible from. Can you see some diagram or some data on the slides? Okay, so is there data on the slide because I can't see from my view?
It's clear of that.
Okay, so now, we have talked about the importance of interprofessional collaboration, but does interprofessional actually make any difference? Because we are promoting again and again interprofessional collaboration, but have we seen any evidence that in the clinical world that benefit from interprofessional collaboration? The answer is yes. So these are some of the evidence that you can see from a pharmacy-led intervention when pharmacists are being introduced into the discussion of patient care. These are the numbers that we are seeing, the improvement of patient. So studies have consisted from about 200 papers on 200 papers or more, I think, that reported about the benefit of interprofessional collaboration in the clinical setting. So most studies consistently reported a substantial reduction of glycosylated hemoglobin, HbA1c, for diabetic patients. We are seeing more and more evidence from this. Also, cardiovascular outcomes also show a much improvement, systolic blood pressure reduction, and also fasting blood glucose with the metabolic indexes have also improved. So this shows that IPC is actually working when being introduced or when actually being promoted in the clinical setting. And the next slide, please. Not just in chronic diseases as in diabetes, cardiovascular diseases, the improvement of patient care in the specialty clinics, for example, pain management, cognitive impairment, or psychiatry has also seen improvement of the improvement of patient care due to pharmacy-led IPC. Okay, so they are much more. So from this data are only showing when pharmacist is being introduced in the IPC. I'm sure there are more and more data itu can be found when pertaining to nurses, pertaining to psychiatrists, pertaining to what you call it physiotherapists and so on. But just from when pharmacists are introduced in IPC, these are the numbers that we are seeing, the evidence that we are seeing from the improvement, from the patient care, improvement of patient care in diabetes and cardiovascular diseases when IPC is introduced. Okay, next slide please. So just to highlight a little bit, so clinical knowledge consistently leads at each transition from evidence to practice to understanding to patient to community. So it leads bit by bit. The pharmacist embedded in an interprofessional team and extending into the community basically is the professional special is equipped to prevent the leakage and ensure that pharmacological knowledge reaches the patient. This is very important. Reaches the patient, the family, and also the community where the chronic disease actually live. Okay, so this is important. This is where interprofessional collaboration actually is important to ensure that the linkages at every point can be reduced. Okay, next slide please. Okay, now just a little bit about the pharmacist evolution. So having discussed the importance of interprofessional collaboration, so I hope every students, especially now, appreciate the importance of interprofessional collaboration at this point. So we want to focus the unique contribution of pharmacists or pharmacy assistant as well within this healthcare ecosystem. So now, if you can see on the left hand side, the role of pharmacists has emerged. Ataupun dah change significantly over the past decades actually. So traditionally, pharmacists were often perceived as professionals which the primary responsibility is to dispense medication. That's it. Dispense medication accurately and safely. While dispensing remains the essential responsibility of pharmacists, the needs of patients with chronic diseases have also expanded the role of pharmacists considerably. Okay, pharmacists and also perhaps in the future pharmacy assistant. So now if you see on the right hand side, today's pharmacist is more than dispenser. They are medication experts. They are clinical consultants. They need to advocate for the patient as well. They are educators. They are community nurse, transforming pharmacological knowledge into better patient and community. Important has emerged now. What is important is to appreciate that none of these activities, although none of this role can occur in isolation. Okay, medication review, adherence, counseling, nutritional advice, community screening. This is becoming more and more prevalent now. Every intervention becomes more effective when healthcare professionals work together, because again, chronic diseases are complex and no single healthcare professional has all the answers. That is the take-home message. Okay, next slide, please. Okay, just want to check it. So now, we have talked about why collaboration matters, interprofessional collaboration matters. We've seen that scientific knowledge must move beyond the laboratory and the clinic into the community. It needs to reach the patients, it needs to reach the families, it needs to reach the communities where real behavior change happens. So this is actually relates to what the Vivian lecture just now. So, but this raises another important questions actually. So if no single healthcare professional can carry this knowledge all the way to the community, then who does? So the answer is all of us working together. Okay, so international collaboration is not simply different professionals working alongside one another. It is actually each profession